Welcome to the new and reimagined Nurse Your Pet blog site. I'm Dr. Rob Silver, the founder of it, but we've made some remarkable changes to the blog site where we have two more veterinary specialists in integrative medicine to join us in the conversation. And today I wanted to introduce those veterinarians, Dr. Joyce Harman, whose area of expertise is in the equine, and Dr. Gabby Varcoe, whose expertise is in rehab and pain management. So first, let's say hi to Joyce.
Hi, Rob. It's a great pleasure to join you in this project. We've known each other for years, and I think the getting together this way, the ability that we have to share information with the pet owning, horse owning public is going to be a lot of fun.
I'm excited. Thanks for joining us, Joyce. I know you're a busy person, so I'm glad that you can find some time for this. And Gabby.
Hi, thanks for having me, Rob. It's a pleasure working with you and Joyce, and I look forward to future adventures with you guys and educating the pet population and the pet parents.
We're looking forward to learning a lot more from you, Gabby, about how we can rehab, how we can help our animals get through their mobility and their pain issues, something that you've become quite the expert in. So we're looking forward to that. Thank you for joining us. So one of the virtues, I think, of having three of us together, and one of the things you'll find as part of our blog, is that we're going to have conversations, three-way conversations, where we're going to be discussing different topics that involve our own expertise, but also have dialogue back and forth. And I think that's something that's really very interesting when you get to hear veterinarians discussing pros and cons of things they find to be their favorite treatments or their favorite modalities. So in that, to that end, I thought we would start by having a conversation with a couple of questions regarding the use of CBD in our patients, something that is of great interest to so many pet parents out there. And I guess I'd start with a really simple question first, and I'll pose that to each of us, and I'll go last, ladies first, as they say, although I want to make sure I'm being politically correct about that. I'd like to know, Joyce, what is your approach to the use of CBD in the horse? What have you found to work? What about dosages? They're so large, it must be really expensive to treat them. So let's hear from you first, Joyce.
Okay. CBD is actually an amazing product in horses because horses are herbivores. They're natural herbivores. So they go out and eat plants and they're very responsive. And we look at the horse as this 1,000, 1,400 pound, 1,500 pound animal. And we think, oh my God, we have to give, this huge amount of an herbal product. But what's really interesting is that a lot of these horses really only need twice a human dose. So maybe 3 times, and some of them even less than that. So what I have found is that around a 25 milligram dose of high quality CBD is a good starting point. But if the horse is known to be real sensitive to either herbal compounds or to drugs, then you can start out at half of that amount, because many times you will get a response. And let's say we're looking at a stiff old horse or something like that, and you start out at a half a dose and they start moving better, they start running around the pasture more, bucking and playing and carrying on and being a horse, you go, well, maybe I don't need to give any more than that. So you might be on a 15 milligram dose, which is not that much more than you might be giving a big dog. And so it can become quite affordable.
I was really amazed to find that horses could get benefit from such low doses. And in fact, Joyce, you and I did a little dosing study together, kind of an informal dosing study. I was able to recruit 30 horses for the study. I think you were 10 of those horses, weren't you? And we were using dosages of 25 to 50 milligrams once to twice daily. And had some pretty decent responses. In fact, as I recall, you've said that if you started giving them more, they stopped listening to you. It's like they just kind of settled down.
Well,
I'm not going to participate, you know.
some of them, especially on the 50 milligram dose, were very relaxed. Not to the point of being like out of it like a drug that you're trying to sedate them with, but definitely just not, you could tell it was too much. They just didn't need that much. And on the other side of the coin, I have a horse with a uveitis eye disease that is actually on one drop, which would be a cat-sized dose. And the ophthalmologist has consistently said that the eye is better than it had been in the previous 6 months. And so that horse happened to be extremely sensitive, but it shows that the sensitivity of the animal and the fact that horses do so well with herbs in general, they do extremely well with the CBD, and they don't necessarily have to have huge volumes.
Very true. We're finding more and more that really it's very individual. It's up to the individual, not it's their size, their condition, but also their individuality. And some seem to respond remarkably well to dosages that seem way too small. But these are objective findings. So it's really great, that you can do that. Well, let's turn our attention to Gabby for a moment. And so, Gabby, what have your experiences been using CBD in your patients that oftentimes are painful and pretty stressed out when they come to see you?
I think it's been pretty variable. More and more clients are coming with their pets already on different CBD supplements. Some I've been familiar with and some I haven't because there are so many on the market. Yeah, and their impression is they want to go with something that is perceived as being effective but safe because it's natural. And you can speak more of some of the evidence that's out there on safety and efficacy, but it's been a little bit difficult to figure out which aspect of their multimodal management is due to the CBD itself, because they're coming already on it and already on multiple different medications and supplements, and then we're adding modalities and manual therapies on top of that. So I can't specifically say CBD alone because I haven't had many patients that are just on the CBD supplement and nothing else. So it's still a little bit up in the air on how those patients are doing specifically on that. Clients do perceive that their pets are better on it, whether that's placebo or an actual improvement is really hard to say. Again, also depending on the supplement they're on and the quality of that supplement.
When they come in on these CBD products, do you find that the dosages they're giving are appropriate as far as what we've now learned regarding dosing by weight? Because I mean, we mentioned with Joyce, there are other considerations other than dosing by weight, but certainly that's where we start, is dosing by weight and what condition we're going to be using. An animal with more pain probably needs a higher dosage. An animal that it doesn't have pain but has anxiety might be able to get by with a lower dosage. Are you finding that they're coming in with already having figured out the dosages?
Sometimes yes, and sometimes no. So it's been really variable. Some people are giving more than the label, some people are giving less, and then when you look at the label and you try to figure out what their milligram per kilogram dosing is based on their product and how how they're dispensing it, whether it's in oil or a chew or a capsule, it's been really variable across the board. So I don't think there's been consistency in dosing that I've noted.
Well, and there is a lot of variation even amongst products and amongst how they report what they have in them. And there have been some studies that have shown that oftentimes they're not meeting what they're claiming to have on their label. So that's one reason why I think for the consumer, it's a good idea. And I'm not promoting anybody's individual product, but that's why it's a good idea to use a product from a reputable company, from a reputable manufacturer, product that many animals have found benefit from, not just your next door neighbor, for instance.
Agreed.
Well, for myself, just to introduce myself to the audience here, I've been an herbalist, an integrative herbalist for many, many years. And when the legalization of medical marijuana came around in the mid 2000s, here in Colorado, where I practice, patients started coming into my office that had been given some medical marijuana from their clients. And we started seeing some benefits that could not be explained from the herbs I was using, or the acupuncture I was using, or the conventional medications I was using. And it really got my interest. And so I started studying it a lot more, studying the research, talking with other veterinarians, and trying to put together a product that had my name on it, that I could put out there, that had hemp in it. And we found that what I found was that there's a lot of education that we really need to do to the pet consumer, to the veterinarian as well, because there is so much out there that we don't know about in terms of the science. And there's no standardization at this point in terms of the products, the manufacturing, and regulation from the regulatory agencies like the FDA. So I've been on a mission to educate veterinarians, educate pet owners about the values and benefits of it, and also about some of the risks that we see as well. And so that's where this blog site and joining up with two of my most favorite colleagues is my is my way of helping to improve the education of pet owners and out there, as far as how they can best use not just CBD, but we're going to talk about other herbal therapies like turmeric, and we're going to talk about other modalities like laser therapy and underwater treadmill, and all the different modalities that are available to us that are not drug modalities that can help make the healing process that much better for our pets.